We're here at the Miami-Dade Fire Rescue EMS Symposium.
Put on by Miami-Dade Fire Rescue, but it includes personnel from lots of different agencies and departments. The symposium is focused on providing different training and education opportunities for fire rescue and EMS personnel.
Pediatric emergencies, although they're not common, they happen. The idea is really to try to get as much hands-on training as possible, and training is the only tool we have that is reliable to make sure our techniques are sharp and that we know how to deal and give the best treatment possible.
Also give really critical information to the receiving hospitals and trauma centers about what's going on with that patient.
Right now they're going over intubation of pediatrics and overall basic care. A lot of firefighters and a lot of other healthcare professionals have a hard time dealing with pediatrics. It's harder and scarier and raises anxiety of the caregiver, so they're trying to make firefighters more comfortable.
EMS is really fascinating because so much of it has to do with really how much time you have to getting to the hospital. And so the longer time you have, the more all of this is important.
The quicker we're able to secure our management of severely ill pediatric patients really is super important when we're talking about improving patient outcome.
Like all of our courses, we make sure that we pair high quality interactive didactics with hands-on training.
It takes a village. When you're doing your clinical practice, you can help one patient, but when you're teaching and you're disseminating knowledge, your range is much bigger. You can help a lot of patients, which is again, the final outcome we all want.